Hey guys, welcome back to the channel. Thanks so much for joining me and thanks for all your support. You guys have been terrific and you've been giving us great ideas for doing new episodes. You know, the other day I went and got an executive physical and I started thinking to myself, rather than going on a fishing expedition, what are the criteria that you should use to go to the doctor? Hey guys, I'm Dr. Nene, a US trained cardiac, thoracic, and vascular surgeon and a general surgeon. As a healthcare innovator and a health tech innovator, I want to empower you to your best health ever. On this channel, we will share evidence-based medicine from all of us to you through our experiences and training about health and healthcare. The goal is to help you make informed decisions about your own health as well as that of your loved ones. We're here for you, so don't hesitate to reach out. The truth is this, that in India as well as the world, there aren't enough docs and there's too many patients. And oftentimes medicine is a natural history study. The only way we can get ahead of that is to change the dialogue to prevention, early recognition, and early treatment. And in order to do that, you can't just go to the doctor when you're sick, because that's what most of us do. So what are the guidelines and why should you do it? First off, by going to the doctor more often on a yearly basis or whatnot, per the recommendations I'm going to tell you, you create a relationship with someone who actually knows you and cares for you. Secondly, you potentially are uncovering life-threatening illnesses as well as normal illnesses, and you can avoid getting sick. Third, you can stay ahead with your vaccinations and with other things in terms of preventative measures, so that if by chance something happens, they can intervene sooner and catch you at an earlier stage and thereby get you to health sooner. So there's lots of reasons why there's a benefit to actually going to your doctor. But how often is that? And most of the academies in the US as well as in India suggest that if you're less than 50, once every 3 years is probably adequate, unless you have some type of family history for heart disease, diabetes, high blood pressure, strokes, or other things, or alternatively, if you have an existing history in your own self for those things. Above 50, it changes a little bit. And in our opinion, probably a yearly physical to your doc to just say hello and kind of go through the motions is probably warranted. Now, what is it that you should do when you go to the doc, and what should you expect? Well, look, there's a whole host of vaccinations and other things which are pretty much standard in the pediatric population. And in kids, it's pretty standard as to the schedule of visits as well as the vaccinations. In adults, it's a little bit different, but a yearly flu shot is certainly in order. Nowadays, with the COVID vaccine, it sounds like we may have that every year. But in addition to that, if you're over 50, a shingles vaccine, which is available in the US in a series of 2, is warranted, and a pneumococcal vaccine is also warranted after the age of 50 to 55. Secondly, when you go to the doctor, they should be doing an accurate history, which includes your family history, your past medical history, your social history to identify any type of habits or other things that you're into, and also doing a thorough physical exam. Based on that physical exam, they can look at your anthropomorphic measurements, meaning your BMI and other factors, figure out if you need to drop a little weight or you need to bulk up or you need to do something else. And they can also identify your goals as to what it is you want to achieve. Then based on that, they can do specific testing. And it depends on your age, but if you have a history of heart disease in males, I would start checking certain parameters like cholesterol and whatnot earlier. If you don't have that, it can be delayed. In females, you have to do cervical exams, pap smears in particular, as well as routine breast exams. And in particular, over 40 to 50, that becomes standard. In men, similarly, prostate exams. And then after the age of 50, colonic examination is warranted once. And then if that's negative, you can have it up to every 5 years to make sure. Now, if there's any changes in your health, you have to let your doctor know so that they can do the appropriate assessment. Finally, the last question is that people have asked me is, when do you go in? And in my estimation, if you kind of time it, you can get your vaccinations done at the same time as you get evaluated. But I would say less than 50, as I stated before, once every 3 years, above the age of 50, once every year. And then if you have a series of issues or you have a strong family history of issues, it can be much more regular. Why does this make sense to me and to you? It's so that we avoid problems. We go to prevention, early recognition, early treatment. And in doing that, if you catch diseases early in their natural history, the outcomes are certainly better. Now, the last question that I'm going to say is, do you need to have a myriad of tests? In my opinion, if they're not going to change your treatment, they shouldn't be done. And why that is the case is it just floods you with data without necessarily improving what you do or how you do it. Maybe it'll give some people peace of mind by saying their stress test is negative. But if they never really had an indication for a stress test, why are we doing that? It just creates one more element of stress for them. And whether it's positive or negative, even if it shows a little bit of calcium or whatnot, it can be problematic. Anyway, in another episode, I'll tell you about the executive physical and how that went. Very interesting fishing expedition. And to be honest with you, some of the things made sense to me, some of them didn't. But for you guys, I think it would be great to kind of come together. Tell me what you do. Tell me when you go to the doc, or is it just when you get sick? I know for most 20 and 30-year-olds, that's the case. But what I'm saying to you is once every 3 years, guys. And if you're over 50, every year, right? Find someone you trust and go share with them and have them see you regularly. That way, when you do get into a pickle, you can pick up the phone and say, hey, you've got my continuity of care, you can help me out, you can steer me in the right direction. So if you have any questions, feel free to reach out to us. I appreciate you watching, and if you like what we're saying, hit the like button. If you want to get more videos like this and see them pop up on your phone, hit the subscribe button and the bell icon. And finally, don't forget to share this with all your friends, because I think this is really important. Take care. It's great talking to you as always, and I look forward to seeing you soon.